our screen?
Yep, we can see it.
Great. So thank you all for having us here today. Today we're just going to talk a little bit about demystifying health equity, so some tools that our office has to kind of move from thinking about equity as a concept to applying equity to your daily work.
And I am going to kick things off by talking about our office and describing some of much of the work that we do and how we do it, and then moving from there into some definitions to make sure that we're all on the same page in terms of what we're talking about today. And then finally, before turning it over to Vaish, I want to spend a bit of time talking about the historical context for how we got to where we are today in terms of the inequities that we face as a state, as a country, and as a society. So the mission of the Office of Health Equity is to build partnerships to mobilize community power and transform systems to advance health equity and environmental justice. And our vision is that every Coloradan have equitable access and opportunity to thrive, regardless of who they are or where they come from. We have three primary mechanisms for how we go about the work, and those three mechanisms are coaching, connecting, and changing. In terms of coaching, we provide technical assistance as well as capacity building in forums such as this, so we really appreciate the opportunity to have this or be a part of this discussion. It's really important that we all take every opportunity that we can to make each other better, to think through our work and how to incorporate equity into it. I say all the time that I don't necessarily believe in expertise as it relates to equity, but I do believe in a difference of perspective, and that is what I pride myself and my office on in terms of bringing to the table as it relates to the work. In terms of connecting, that's our acknowledgement that when it comes to achieving equity, it is impossible for us, where we sit at the Colorado Department of Public Health and Environment, to accomplish that task and that goal on our own. Equity has to be the work of all of us, regardless of sector, whether it's transportation, housing, education, and the like. We all have a role to play, and so we seek opportunities to connect with other sectors whenever possible to, again, to pursue that goal of making each other better and advancing the work and continuing to learn and to grow in our work together. And when it comes to changing, we seek opportunities to change the narrative as well as change the story about what really creates health, and we're going to spend some time on that just a little bit later. But changing the narrative and changing the conversation about what creates health and the conditions that creates health is really critical to the work that we do in terms of advancing or seeking to advance health equity. Can you go back to that slide for a second? People, let people digest this just for a second. My team are big fans of animal memes, although I am not necessarily myself, but I had to give it to them. This was pretty good.
It makes us bigger fans. That web isn't quite as much of a fan as we are.
Just to get into a few definitions to make sure that we're all on the same page in terms of what we are discussing here today. When we talk about the social determinants of health, we're really referring to the socioeconomic factors that are the strongest drivers and predictors of our ability to be healthy. And these include such factors as housing, the ability to pursue educational opportunities, live in a safe environment, have access to quality and affordable healthcare as well as affordable housing, and effectively eliminating discrimination, stressors, and trauma from the environments in which we live. So when it comes to health disparities versus health inequities, the way I like to explain the difference between the two is simply with one word, and that word is context. Health disparities simply refer to differences in health status. There's no context provided for how those differences in health status came to be. Health inequities, however, explains the context or provides the context that these differences in health status occur between groups of individuals that are more socially advantaged versus those who are less socially advantaged by systemic differences in social conditions and processes. Again, going back to the previous slide, those differences having everything to do with housing, education, transportation, a safe environment, etc. The really key takeaway here is that these inequities are avoidable, they're unjust, and therefore they are actionable. The inequities are the results of decisions that have been made historically to advantage some groups at the expense of others. So since these systems were not created with equity in mind, it's also possible to recreate these same systems to be more equitable in nature. So in terms of the root causes of inequities, again, these are systemic and resulting from systems that were not designed with equity in mind, policies that created systems of unbalanced power and privilege, again, designed to advantage some at the expense of others. These are caused by historic practices of exclusion and discrimination. Again, this is the society in which we live and the environments in which we live have been intentionally created to be the way in which they are and to not be equitable. So these historic practices and policies and decisions that were made led to geographic concentrations of poverty and hypersegregation, which I'll get into in the next couple of minutes. So this is the definition of health equity that the Office of Health Equity recently adopted. And when I say recently, I mean within the past week. Equity is when everyone, regardless of who they are or where they come from, has the opportunity to thrive. This requires eliminating barriers like poverty and repairing injustices in systems such as education, health, criminal justice, and transportation. In this definition, we're trying to accomplish 3 goals. Number one, and most obvious, is simply providing a definition of equity and getting us all on the same page in terms of what it is that we are talking about when we use that term. Number 2 is we wanted to include a call to action in terms of the type of action that is required on behalf of all of us when it comes to working to achieve equity. So this call to action is the requirement that we work to eliminate barriers such as poverty and repairing injustices in systems. The third goal with this definition was to call out the importance of a systemic focus, an acknowledgement that it's the systems, it's the inequitable systems of which we are all a part and in which we all play a role that are the cause of the inequities that we face. So defining equity, call to action, and systemic focus. So when we talk about equity, we're talking about being intentional and focused on the needs of individuals, families, communities, and not taking a one-size-fits-all approach. That would be equality, and that's simply not good enough. Equity is a process and results that are both fair and just, as opposed to what I would refer to as talking a good game, having good intentions, but having little, if any, follow-through. My team has often heard me refer to this as having diarrhea of words and a constipation of ideas, talking a lot, but we're really not being about anything. Equity requires removing barriers so that everyone can thrive, as opposed to helping people simply survive. One of the things I find really interesting is that when we as a field of public health professionals talk amongst ourselves, often without meaning to, we find ourselves in situations where we are taking a survival approach to the work as opposed to a barrier removal approach to our work. And what I mean by that is we often think about ways to help people living in less than desirable circumstances more effectively deal with and live with those circumstances, as opposed to focusing on changing the circumstances or the environment itself. And that's something that we simply have to move away from. And lastly, equity is about what you do and how you do it, as opposed to simply taking a course of action with no intention behind it. Also referred to as box checking. One of the things I always try to keep in mind is that there's a big difference between action and movement. In other words, simply because you are doing something does not mean that anything is actually occurring as a result of that action. So now to provide a bit of historical context. The slide reads that 3 feet of ice does not result from one day of freezing weather. And obviously the point here is that the situation in which we find ourselves as a community, as a state, as a country did not result overnight. And so it's really critically important that we take not just a systemic focus to the work that we do, but also a long-term focus and acknowledge that we need to be mindful of a long-term approach when it comes to how we not just do our work, but also how we define success. I'm sure many of you are familiar with a historical racist policy called redlining. And what redlining was, for those of you who may not be familiar, is going back to the 1930s, the federal government legally sanctioned a racist policy whereby banks were able to deny loans for home purchases to people who lived in or were buying homes in certain communities. As you might have guessed, these communities tended to be almost exclusively communities of color. And so by denying people the opportunity to purchase homes in these communities, the result was hyper-segregated poverty as well as segregation by race, primarily in urban centers across the country. What's interesting is and by the way, this is a map of Denver. And the red areas on the map denote areas that were redlined, whereby these communities and people looking to purchase homes in these communities were not able to do so or able to borrow money to buy these communities. What's interesting is if you take a map of poverty from today in the city of Denver and overlay it on top of the redlining map that you see before you, you probably would not be surprised to know that the areas of highest poverty almost exactly replicate or are located in the red areas on the redlining map. So the important takeaway here is that historical decisions have modern day consequences. And make no mistake about it, we are very much dealing with the consequences of racist policies such as redlining today in our daily work. What you see here is an example of a racially restrictive covenant from a home sale contract in California from about 60 years ago. It says no person or persons of the Mexican race or other than Caucasian race shall use or occupy any building or any lot, except that this covenant shall not prevent occupancy by domestic servants of a different race domiciled with an owner, tenant, or occupant thereof. So in other words, you cannot sell this residence to anyone of any race other than white. Not only that, you are not permitted to have anyone other than white people living in this residence unless they are serving in a domestic capacity. So along with redlining, the unofficial policy of racially restrictive covenants also served to hyper-segregate by race many urban centers across the country. Now, I want you to just imagine for a minute with me, if you will, being a person of Mexican descent or an African American who has been trying for 3 years to purchase a home in an area with good schools, that was safe, and that would be the ideal place in your estimation to raise a family. You've been trying for 3 years, going from bank to bank, and because of the racist policy of redlining, have been unable to secure a loan to purchase a property. So rather than allowing that to stop you, you say, well, clearly I'm gonna have to do this on my own. So you work your tail off for a period of about 5 years to save up approximately $10,000 to be able to buy a house in cash. However, in most of the neighborhoods that you are seeking to purchase a home, racially restrictive covenants are very much in effect. And you're excluded from purchasing a home in neighborhood after neighborhood after neighborhood. But finally, you manage to find a neighborhood that does not have racially restrictive covenants as a part of their home purchase process, and you are finally able to use your $10,000 to pay cash for a home in an incredible neighborhood with amazing schools that is safe and a wonderful area to raise a family. And oh, by the way, it's exclusively white, with the exception of you and your family. And then over the course of the next 24 to 36 months, you watch as house by house, on block after block near you, goes on the market for sale. And your neighbors are selling to other people of color, primarily African Americans. And as a neighborhood becomes more and more African American, the level of investment in the community from businesses, from investors, from home builders rapidly declines, and therefore so does the neighborhood. And so this community that you moved into, that you had such high hopes for and such dreams for sending your kids to amazing schools so that they could go off and have amazing lives, all of a sudden very quickly becomes a nightmare. That story is not one that is made up. That's actually the story of my grandfather in Jacksonville, Florida, who saved up enough money to buy in cash a home for he and his, at the time, 5 children, one of whom was my mother, and watched the neighborhood over a 2 to 3 year period rapidly decline. And so the schools that my mother was going to be attending that were so fabulous when he moved in quickly went in the other direction. And over the course of her 12 years of schooling, my mother went from going to some of the best schools, not just in Jacksonville, but in the state of Florida, to some of the worst schools in the state of Florida. And therefore was not prepared to go to college and did not. Spent her life working blue-collar jobs, was never able to save a dime for retirement. Her and I lived in Section 8 housing until I left for college at age 18. And history tells us that I very much should have been a part of that same type of story. And if not for the generosity of an elementary school teacher who provided me with a secret scholarship to go to a private school, I very much would have been a part of that same sad story and not here talking with you today. I don't tell that story because it represents equity. I tell it because it represents just the opposite. No child should ever be dependent on a benefactor simply to have a fair and just opportunity to succeed. Once again, going back to what I said earlier about the importance of noting that historical policies, historical systems, historical decisions have modern day consequences. So those systems and policies that were in place in the 1950s have resulted in my mother subsisting and living on just under $1,100 a month from Social Security because of the generosity of a benefactor. I have a very different opportunity, and so do my kids. I don't tell that story for emotional purposes or anything like that. I just think it really highlights the importance of the work that we do, the decisions that we make every day. And oh, by the way, not just in our professional lives. I often say that equity cannot be a hat that you wear from 8 to 4 or 9 to 5. This has to be about the decisions that we make in our personal lives as well. Where we decide to live, what schools our kids go to, who do we socialize with, where do we spend our time, where do we worship, what kind of people do we spend our time with. Every decision that we make, whether personally or professionally, is an equity decision. And it's important that none of us ever forget that. So while today is focused on how do we incorporate equity into our work, yes, that's critical, but it's not all. And with that, as we move into more of a focus on the work itself and some of the tools that the Office of Health Equity has to help us to get better at the work and incorporating equity into our work, I'm going to turn it over to Vaishnavi.
Great, thank you. So, as Webb said, we've kind of created a set of tools to help folks kind of understand. So we have this big concept of equity. And so how do we take it from the theoretical to the practical and apply it to the work that we do on a daily basis? So the Office of Health Equity created what we call the suite tools to advance equity. We think they're pretty sweet because we try to keep them kind of short and applicable to the everyday work that we do. We're also not the greatest at coming up with really fascinating names for our tools, so we just kept it simple. But we have 5 tools right now, and they're kind of an ever-growing list, and so we're constantly looking for opportunities and thinking of different situations in which we are using equity as a lens or a framework and what else we can add to the list. But for now, we have one document called Checking Assumptions, another one, Meaningful Community Engagement, Framing Data, and then a 2-part tool on measuring equity efforts. And I apologize, I'm not sure if folks can see, but at the bottom of every slide, I do have resources and all of these links linked, and so when they do get shared, you'll be able to see them, but I'm not sure if you can see them as we share our screen. For us, they're kind of hidden, so I apologize for that. So the question of why did we create the suite tools? So we recognize that there's a wide range of activities: diversity, inclusion, equality, and equity. And so as we think about how we move on this spectrum from diversity to equity, we have to really think about taking, as I said earlier, equity from a theoretical framework to something that we can apply to our work on a daily basis. And so the reason we wanted to keep these tools kind of short and sweet is because we want them to kind of get ingrained into our everyday processes and become habit, essentially, for us to ask these questions on a daily basis, so that eventually we get to the point where we don't have to take these tools with us on a daily basis, but it just becomes part of our rhetoric and part of the lens that we use to view the work that we're doing on a daily basis. So the first tool that we have is called Checking Assumptions to Advance Equity. The audience for this tool is really anyone, and the goal is to review how an action or decision might impact groups of people that are most likely to suffer preventable adverse consequences. So really the questions are all geared towards what unintentional consequences might there be as a result of the work that we're doing, and how might we be able to address those unintentional consequences. And this tool is applicable, excuse me, to both new policies, programs, and policies, practices, but also existing policies, programs, and practices. So we designed the tools to have questions that you can ask yourself as you're thinking of new policies or programs to implement, but it's also something that you can use to review an existing program, policy, or practice, and kind of ask yourself those questions as you're reviewing: is this an equitable policy, program, or practice, and how might we be able to address any unintentional consequences that are arising? So just some of the questions that we have on this tool. So who determines what the decision-making environment looks like? Have all decision makers taken a few of the project implicit tests individually? If folks don't know what project implicit is, it's a project out of Harvard University that really provides a couple of quick, almost assessments that help us think about our implicit bias, and what implicit bias we might be bringing to our work. So what lens we might unintentionally be bringing to our work as a result of our environment or the experiences that we've had. How will affected communities be involved in defining outcomes and success? Have you used a variety of data sources to identify the most affected communities, and which communities should be given priority in this project process or policy? So these are just a sample of some of the questions that are in the Checking Assumptions document, but the entire document can be found on our website. And again, as I said, the link is below, and you should be able to access it when the slides get sent out. So for each of these tools, we wanted to provide an example of a real-life scenario or a situation in which something like this has actually been applied. This example actually comes to us from King County in Seattle, Washington. So in this county, King County Public Health Department had developed their own set of questions that are very similar to our Checking Assumptions document. In the county, there was a certain neighborhood that had a really, really high rate of crime. And as folks were kind of looking at the data over the years, they noticed that the crime had skyrocketed or peaked in kind of a 12-month, 6 to 12-month period. So the mayor was really fascinated and kind of interested in knowing why this had happened in such a short period of time. So he organized a trip to kind of go to this neighborhood and drive around and kind of examine what the situation was like. It just so happened that they were doing this in the late evening, early night time period. And as they were driving into this neighborhood, they noticed that as they got from one neighborhood to the next, suddenly there were no working streetlights. So the neighborhood in which the crime had spiked had no working streetlights, and it was a very dark street. And so the mayor was kind of asking around. He asked his staff, why is it that there are no lights that are working in this neighborhood? What's going on here? And his staff went back and looked up and realized that the policy that currently existed for addressing streetlights was that community residents had to call the city or county and report that the streetlights were broken. And reviewing some of the questions similar to the checking assumptions document, they realized that perhaps this wasn't the most equitable policy because the communities in these neighborhoods didn't have best trust for government because of historic policies that had discriminated against them, or just experiences in the past of not having government officials respond in a positive way. And so what they ended up doing actually was changing the policy to create a maintenance schedule so that folks were driving around to all of the neighborhoods in Seattle on a regular basis, checking if the streetlights were working, and then replacing the lights on a consistent basis and on the spot. So what this is a really good example of is that when you come up with systems that work better for the most vulnerable, you also come up with systems that work better for everyone. And so we really like this example of equity because it's applying an equity lens to one situation that then results in multiple communities and all communities benefiting from the situation. So that's just one example of a way that the checking assumptions document has been used on a citywide level. So the next tool is authentic community engagement to advance equity. So the audience for this is local and state government, nonprofit, and community-based organizations. And then the goals are to really help users thoughtfully engage with communities and avoid unintentionally perpetuating inequities. So an example of some of the questions that you'll find on this tool: how is community defined for this project, program, or process? Why are you interested in engaging with community members? So really, again, trying to get at the goals and the intentions for the engagement. What has been the history of engagement efforts in the community in the past? So this goes back to kind of the previous example I just gave with the streetlights. Really thinking about what type of relationship has the community had with community engagement in the past. Has it been a positive experience? What's been successful in the past and what's not been successful, and how will that affect your process? So what course correction can you make after learning from the history of engagement efforts in the community in the past? And then really thinking about what type of power the affected community has in decisions that are being made. So we know that in engagement efforts, power is a really important thing. It's important to consider whether we'll be collaborating with the community, whether you simply need to consult with the community. So is it a situation where you need to gather some information in a one-time basis? And if so, how do you clearly communicate with that? Communicate that with the community and set expectations so that community members understand what their participation is going to be and how that participation will look like in the process of the project. So being really clear about expectations as well. And then how are affected community members involved in defining success, if they are? And if they're not, again, how do you set those expectations and clearly communicate with community residents what the expectations are of their involvement? And then finally, how are you communicating results back to the affected community? So a lot of times we find ourselves engaging community members in projects, but not necessarily having the follow through of communicating those results back to the community or letting the community know how their input was valued and incorporated in the process. And so a lot of these questions really focus around that clear setting of expectations and communication with community members and really respecting and valuing community power and knowledge in the process. Another tool that we have is framing data to advance equity. So this one, again, applies to communities, and it really, the audience is really anyone who's working with population data. So again, it could be local governments, it could be nonprofits, community organizations, anyone who really uses data and then disseminates data out to an audience. And the goal is to provide basic steps for considering how to frame data and tell the full story. So why is this important? Framing data is really about thinking about the lens that we all bring to the work. So we know that we're influenced by our geography, the news, our environment, our upbringing, and that really shapes the lens that we use to view the world. So as professionals, when we're presenting data to be disseminated to the public, it's our responsibility to think about how we frame that data so that we're providing individuals with the context to understand why this data is important and how it's related to advancing equity and justice. So this tool is a little bit different than the other ones in the sense that it doesn't have questions as much as it provides some tips to think about as you're putting together a product with data in it. So the first tip is to tie data to systems and not individuals. And by that we mean, again, providing that context. So for example, if you're providing diabetes rates by race, providing that in the context of high school dropout rates and poverty data by race, because we know that health outcomes are tied to educational level and socio and economic status. That actually determines about 80% of our health is socio and economic factors. So tying those health outcome data back to socioeconomic factors helps provide the context of why certain races might experience higher rates of diabetes than others and takes it away from individual choice and individual behavior. Tip 2, include data from other sectors. So providing additional data frames the context and helps people understand a more complete picture. So for example, if you're providing data about STI rates, we know that 1 out of every 4 girls has an STI, but at the same time, 80% of physicians do not offer STI screening to patients under 18. So providing some context around why the data looks a certain way helps frame that data as well. And then finally, incorporating the voices of people facing inequities. So as we're collecting data and presenting data, thinking about how we can engage community in that process and how can they be involved from the beginning of the process to help us inform what type of data we're collecting and how we're presenting that data so that it's useful to communities and provides them with a tool that's meaningful for them as they're advocating for things that they need in order to be healthy. So a real life scenario and example that we wanted to give about both of these tools, about the community engagement tool and framing data, is actually a report that we just released. So this is a semi-shameless plug, but also a really good example of how we use the tools that we created ourselves in our own office. So just last week we released a new data project called an Equity Action Guide, Creating Thriving Communities in Colorado. So we use both the community engagement tool and the framing data tool to think about how we're engaging communities in the process of collecting and disseminating data. So we like to call it data democracy. So providing data back to the community, as I said, in a meaningful and powerful way for community residents. So we started the process about a year ago by actually creating some social media polls that some of you may have seen that were on Twitter, Facebook, Nextdoor, and I think those were all the social media platforms. Oh, and Instagram. And we actually asked the community, what are the biggest challenges or barriers that they're facing in their communities, and what are the conversations that they're having around the dinner table? So we wanted to kind of flip the script on its head and ask communities, what would they like us to investigate as far as data goes? What is it that's affecting them in their lives, and what information can we provide that would be helpful for communities? And so we started by asking that first poll of what are those challenges that they're facing. And after we got results, we realized that the top 3 concerns that communities had were around housing, transportation, and then how housing and transportation are affecting their health. And so we actually set the priorities for our quantitative or numbers data collection based on the experiences of Colorado communities. And then from there, we created this report in partnership with an advisory community that had individuals from community organizations, community organizers, who are folks that kind of work on the ground, grassroots, and really help community residents actually build the skills to advocate for what they would like to see, the changes that they would like to see, as well as other state government agencies. And so our advisory committee was involved with us from the beginning in helping us develop the polls, analyze the data, and then create this report. And in the creation of this report, our advisory committee members really helped us make sure that we were thinking about how to frame the data, so that we were talking about other sectors, how transportation and education and transportation and health are all kind of connected, how the communities that we grow up in, how that history, as what I mentioned earlier with redlining, how that history really affects what we're seeing in our Colorado communities today as far as housing prices and hypersegregation. And so the advisory committee was involved throughout the entire process and kind of helping us frame the data. And then in writing the narrative and producing the report, we actually also thought about how do we provide this data to our audiences in a way that it's understandable and not overwhelming. And so really thinking about writing it in a meaningful, plain language and understandable way, and including engaging graphics. So some of the graphics that you've actually seen throughout this presentation, the redlining, the table about what equity is and isn't about, come from this report. So we encourage you to take a look and share with your networks as well. And then finally, we have the two-part handout about measuring performance and designing program evaluation. So the audience for this one is probably the most narrow of all of our tools. So it's really for program evaluators or project managers with an interest in measuring equity efforts. And the goal is to really help folks measure whether or not an agency, program, or project is helping to create conditions for equitable outcomes. And then this one, similar to the framing data one, has less questions and more kind of tips or examples of measures that folks can use. So here's on this slide just a couple examples. So percent of individual employee performance goals that incorporate equity or justice, number of staff who have attended a training or workshop on health equity, number of staff who've then used the skills and knowledge that they've learned from that training at least once within 3 months. So these measures really kind of focus on what Webb was talking about earlier with our table of not just box checking, but how do we really measure that folks are implementing equity into their daily work. So a real life scenario based on that two-part document is the CDPHE strategic plan. So folks may or may not have seen this, but we do have a goal that's focused on promoting health equity and environmental justice. And this past year in the strategic planning process for the next fiscal year, the tool was actually used to develop some measures. So really thinking about how whether staff think that health equity and environmental justice is important to their work, but also measuring whether they've learned from the health equity and environmental justice 101 training we have, how they're applying that to their work, and then continuing with some trainings for CDPHE Type 1 boards and commissions, and really thinking about how we're starting to implement equity and justice at all levels of the work that we do as a department. And then there's a link there if folks are curious to see the specific measures that we included and what they look like. You can follow that link and you'll be able to see all of those. Okay, so we've talked at you enough now. So we wanted to kind of open it up for questions, your real life examples, if you have any of how you've incorporated equity and justice into decision making and how that's played out. But at this point, it is your turn to talk.
Any questions from the audience? You're welcome to unmute yourself. Again, if you're on the phone, it's *6. Or if you want to type a question into the chat, feel free to do that, and you can verbalize that as well. Aisha, I don't know if one of you can turn off your screen share,
Oh, sure.
see each other a little bit more. And the question I would have is, I mean, this is great. Thank you, first of all, for sharing all this information. I think it's really helpful to hear what you've gone through and tips and tricks that you're able to share with the rest of us who are wanting to kind of learn from you and be able to do similar work in our communities as well. As you work in this area, what are some things that you didn't expect you would experience that you were faced with, and how did you overcome some of those challenges?
That's a good question. We have to think about that one.
Well, I don't have to think too long. I have so many, I don't know where to start. I think the work or the challenges that you experience are very much in tune with the environment in which you work. So we are with state government, which is certainly different than working on the local level. And so I think that in particular from where I sit in an administrative role, it is, I've encountered more challenges over things that I would not have originally thought that I would have to fight for, things that just seem to be the right thing to do. When you are in a bureaucracy, one of the things that I've learned is simply because something is the right thing to do does not make it the easy thing to do. And that's been a big lesson that I've had to learn, and also kind of keep with me as I go about my own kind of daily decision-making process of what are some of those potential red tape / bureaucratic obstacles that might impede some of the good work that could come out of the office.
Yeah, and from my perspective, I think, and I see that someone else kind of asked a question that might be tied to this. So like, what are specific steps individuals can take within their communities to support equity? So kind of piggybacking off of what Webb just said about being in a bureaucracy, I think from my perspective as a person who goes to the community and is trying to build networks with community organizers to advance equity, I think it's the biggest challenge that we face is really acknowledging that we haven't had a good history with the way that we've treated communities, quite honestly, right? And being humble about the fact that we're trying to change that, but it really means that building trusting relationships take a long time, a really, really long time. And it's hard work, and it takes a lot of time and resources, but in the end, of course, it's absolutely worth it. But I think specific steps that individuals can take along that line is really being available and being present in communities without an agenda. I think that it's easy and understandable for community to assume that we're there with an agenda of our own and that we're not there to listen to the priorities of community or to uplift the priorities of community. And so I think the more that you can spend time going to the community, spend time in the community, and really get to learn what's important to community residents, and what are their priorities and how can we support those priorities is really, really important. And you know, that's to say it does mean that it takes up more of your time, but yeah, so participating in community neighborhood meetings, and again, this goes back to kind of what Webb was saying earlier about equity is not just a professional thing, but it's also a personal thing. So spending time in the communities that you plan on working in as an individual are just as important for community residents to see that you really care about them, that you have an interest in really listening to their experiences and understanding their experiences versus simply coming in because you have a project or grant money, which is what we tend to do really quite often. And so I think spending time there just as an individual, because remember, we're all community members in addition to being professionals. So we don't lose that status of community resident when we go to work. And so I think tapping into that as individuals and remembering that we also live somewhere and we have families that we care about, and kind of finding that that heart. So equity work is really about head and heart. And so finding that connection to communities is something that I found really helps tackle that challenge of coming from a system that community residents don't necessarily trust.
And going back to one of our earlier slides, just kind of describing the work of the office in terms of coaching, connecting, and changing, that change piece is a role not just for the Office of Health Equity, but it's a role that we all have to play in terms of changing the narrative and getting the story told about what really creates health and the importance of the systems that we mentioned earlier. So how this relates to the question that was asked in terms of the role that we can play or steps individuals can take within their communities to support equity, we all have to be that change that we want to see in the world, going back to the Gandhi quote. It's important for all of us to be and set an example for what the work of equity looks like, not just in our professional lives, but even more importantly in our personal lives. So talking with friends and neighbors and community members about what equity is and why it matters to you and what really creates health and the importance of the decisions that you make. If you can be a trendsetter or conversation starter within your own community, that's also a powerful tool as well from a personal perspective.
Yes, and then we have one other question. So other than implicit bias tests, are there other self-awareness individual work that should be done before engaging in health equity?
Other self-awareness individual work. I don't necessarily think so. I think knowing your implicit bias is important, and acknowledging that we all have them. In terms of self-assessment, that for me is really where it starts. And then from there, you have something to build on in terms of knowing where your areas for growth and where the work needs to be. So I think that's a great place to start. And I also think it's important that people not get overly hung up on doing self-work, and not that it's not important, but you can have analysis paralysis in terms of just kind of getting caught up or stuck in that area and not engaging in other important aspects of the work that we've been talking about. So I think implicit bias testing is a great place to start, and I wouldn't necessarily recommend anything additional. I'd be curious to know what other folks think about that in particular.
Yeah, I would just add to that I think as far as tools go, I think the implicit bias test is a great tool, but I would say the key to doing equity work is to keeping an open mind and to always being willing to learn. We're going to make mistakes, and that's okay, but I think as long as you're willing to kind of learn from those mistakes and be open to talking to other people and understanding what equity means to them and kind of figuring out what equity means to us. I think even for us in doing this work, we always say that we're not experts because it's a learning process. There's always something new to be learned, and so I agree. I think kind of getting paralyzed with overanalyzing can hinder you, but I think it's really important to always just be open to continuing to learn as you're doing the work.
And one of the books that we especially appreciate in the office is called The Cathedral Within, and it's a book about the great cathedral builders in Europe when they were engaged in the work of building the cathedral. Always knew that they would never be around to see the finished product, but that was not their focus. Their focus was on the day-to-day journey or the day-to-day work itself. And that, we believe, is the approach that we need to take as well. The work of equity is not a sprint. It's certainly a marathon. And again, the policies and systems that we've been talking about for the last hour were not created in the last year or 10 years or even 50 years. So again, we have to take that long-term approach and be mindful about the fact that this is going to, it's about the journey for all of us. It really is about the journey and not necessarily focus on the destination.
Very true. With that, I actually have 2 more slides I'm quickly going to share because I see that it's getting towards the end, but to Webb's last point, where you start really helps determine your destination, right? So your lens will help shape the questions you ask, and the questions you ask help shape the impact you have. So to those last questions and to that last point, it's really important to reflect on your starting point, but not to dwell at your starting point, and to really think about where you would like to go and where you'd like to end up, and really think about using that equity lens on a daily basis. So it's not, as Webb said, it's not a hat that we wear, but it's really the way that we look at our work and the way that our work should be shaped.
And the way we live.
Yes, and the way we live. So wanted to quickly say to keep an eye out for 2 other tools that we're working on. So contracts and procurement, really around how to incorporate equity into requests for applications, and then also working on a language justice suite tool around the importance of incorporating various languages and the concept of language justice into the work that we're doing. Finally, we have our contact information, and then we would really love for folks to take an evaluation in the interest of our measuring equity suite tool, living the talk. We have a survey, so when Suzuho shares the slides, feel free to click on that link or scan the QR code below to open up the survey on your phone. Thank you.
Great, thank you both so much. We really appreciate you taking the time to share this information. If anyone's willing to stick around for a couple minutes, I'm going to turn it over to Jason to talk a little bit about how you can get involved with some PDHA health equity efforts as well.
Thank you to Webb and Vaish for that. It was excellent. I'm not going to take up too much time, but I wanted to extend an invitation for those of you who are looking for opportunities to get involved of doing the work of health equity. As many of you know, the CPHA Health Equity Coalition has been convening for the past, since October. We've got a great group of individuals from various sectors and from community who are working in 3 separate work groups. One is community outreach and engagement. The other is organizational infrastructure and professional development and education, which will be taking over the webinar duties starting in September. But for those who are interested, there's a lot of amazing people at the table, but there's a lot of people who are not at the table. We'd love to have you join us. Please reach out to me at Jason Vitello, Vitello @gmail if you're interested in learning more. And stay tuned. In the very near future, we'll have a webinar that will be describing the work that we've been doing and hope to do in more detail.
Great, thank you all. I hope you all have a great rest of your day, and to see you at the September Health Equity webinar, if not at Public Health in the Rockies. Thanks.